So, someone told me that it's not necessarily a good idea when MBAs run hospitals because the MBAs are business people who got a business degree, they're familiar with business, and of course, as you just said, a hospital is a business.
Mm-hmm.
A doctor who actually knows all the components would be in a much better position to run a hospital.
Right.
But a doctor's not a business person.
Not. It's funny that we're not business people, but we are now forced to understand the business side of things. Maybe not with the formal educational training, but one of the things. I mean, I think everyone knows that if you treat enough patients, if you keep the cost low, then you get more revenue. I think that's just a basic, simple concept. Now, MBAs running hospitals may take it further and say, well, we can really reduce costs. We don't need this many nurses. We don't need this many therapists. We don't need, this. And then that puts a strain on the system because now what you've done is affected the efficiency of patient flow through the system, because now you're taking away a lot of components that can help with that. And then that negatively affects the patient experience. But that doesn't necessarily always going to translate to the dollars and cents that the MBA sees, but from patient reviews and Press Ganey scores, there's multiple systems in this area, and they're all competing for the same pool of patients. So if one is offering a better patient flow and experience, that's always going to win out. And I don't see that translating or MBAs necessarily engaging at that level to say, well, in the end it's cost, but in the end it's really about the patient experience.